And welcome back. Dr. Mark Simpson with Simpson Dental Associates joins us now. And if you have a call about your dental health, here's a number on the screen, 1-877-924-7888. And doctor, I want to ask you about this smart dentin grinder you were just telling me about during commercial break. This is pretty cool technology that's just out, isn't it?
It really is. There's a bunch of different ways to graft bone. Now, I can take it from your mouth. I can get it from another human. I can use bovine, which is cow bone, or use a synthetic. But what this is doing is actually utilizing your tooth. So a lot of times in situations where we're replacing multiple implants, we'll have to extract a few teeth anyway. And so you can take these teeth, grind them up, and use that as your bone grafting material. So you're using your own tooth as the bone grafting material. I think it's the greatest idea that I've ever heard of.
Because in the past you would have to take it from your hip or other parts of your body.
That's
correct?
Right, and then you have another site which is going to cause some little discomfort. So by doing this, it's the best of both worlds. It's unbelievable they came up with this technology, but things just
what this is.
Well, this is a teeth in a day case. In other words, what we did is we took out the remaining teeth and too. You got better eyesight. Well, you know what it is? I think she felt so great about the way she looked that she got her hair done and got some contacts. And yeah. I mean,
implant seminars. And how popular are the implants becoming for you?
Well, it's really probably the major part of our practice now, and the reason is because we see a lot of patients who unfortunately have lost a lot of teeth or had situations in the past where they couldn't take care of their teeth or never really had access to good care. And so a lot of people in West Virginia have lost teeth. And so implants are the best way to get back something that's as close to your own natural teeth as possible. So that's why I've seen over the last 35 years, it just seems to be a bigger and bigger and bigger part of our practice.
Let's talk about preserving our smiles so that we may not need to have implants or even extractions. Some of the best ways, I know that your daughter was in here earlier on our ABC show, or Fox 11 show this morning, and she was talking about different ways to brush your teeth and how a lot of times the powered brushes are actually really good because you can't brush too hard because they'll shut off, correct?
Well, that's right, and they do the correct motion so that the rotation of the bristles is just exactly what you want. But if you think about this, you want to angle it up at a 45-degree angle up into the tooth and massage in a circular motion, and that allows the bristles to go up in between the teeth. But the most important thing is that you floss, and that seems to be the thing that so many people say, well, I do it periodically. But you have to do it every 24 hours because the bacteria reproduce every 24 hours. So you've got new bacteria that are attaching to your tooth. They have to be attached to your tooth to feed. And when they feed, they produce acid as a waste product. So you have to physically knock them off. There's no amount of mouthwash, no amount of chewing gum or anything else that will do the job for you. They're actually electrically charged, the bacteria are, and so is your tooth. And that's why it's like a magnetic attraction. That's why rinsing them, it's still that bottom layer stays on there. You have to knock it off physically.
And that's with floss, of course.
Absolutely. So if you only did one, I'd floss. And so
all right, Doc Simpson, thank you so much. No calls today, which is surprising.
It's always a pleasure to talk to you.
Yeah, and we'll see you next week, sir.
Thank you so much.